The glenohumeral joint, we have four muscles, which is pectoralis clavicular head, the anterior deltoid, biceps brachii long head, and the coracobrachialis. So for the pectoralis major, which is a clavicular head for flexion of the arm, the origin would be the medial half of the clavicle. Insertions is a lateral lip of the intertubercular groove of the humerus. Actions include flexion of the arm, medially rotates the arm, adducts the arm, and innervation is lateral pectoral nerve. For the anterior deltoid, it originates at the lateral clavicle. Insertion is the deltoid tuberosity of the humerus. For action, it flexes and medially rotates the arm, and innervation is the axillary nerve. For the biceps brachii long head, the origin is the supraglenoid tubercle of the scapula. The insertion is the radial tuberosity. Actions include flexion of the arm, and innervation is the musculocutaneous nerve. And for the coracobrachialis, the origin is the coracoid process of the scapula. Insertion is at the medial surface of the humerus. Actions include flexion of the arm and adduction of the arm, and innervation is also at the musculocutaneous nerve. For extension of the arm at the glenohumeral joint, we have five muscles on the pectoralis major sternal head, triceps brachii, posterior deltoid, teres major, and latissimus dorsi. So the origin for the pectoralis major sternal head would be the sternum, the upper costal cartilages, which is 1 through 6, and the aponeuros of the external oblique. Aponeurosis. Sorry for mispronouncing that. The insertion would be at the greater tubercle of the humerus. Actions include extension of the arm, medially rotates the arm, and adduction of the arm, and innervation will be the pectoral nerve. For the triceps brachii, the origin is the infraglenoid tubercle of the scapula. Insertion is the posterior olecranon process of the ulna. Extension of the arm would be the action of this muscle, and the innervation of the triceps brachii would be the radial nerve. For posterior deltoid, the origin is the spine of scapula. It inserts at the deltoid tuberosity of the humerus. Actions include extension of the arm, laterally rotates the arm, and the innervation will be axillary nerve also. For teres major, on posterior surface of the scapula at the inferior angle is the origin. The insertion is the lesser tubercle of the humerus. Actions include medially rotates the arm and adducts and extends the arm, and innervation is the lower subscapular nerve. For latissimus dorsi, the origin is quite a couple. It's the spinous process of the T7 through L5 vertebrae, the iliac crest of the sacrum. I don't know if you guys can see. The iliac crest of the sacrum, the thoracolumbar fascia, inferior angle of the scapula, and the lower 3 or 4 ribs. As for the insertion, it is at the floor of the intertubercular groove of the humerus. Actions include medially rotating the arm, adduction of the arm, and extension of the arm. And innervation is the thoracodorsal nerve. As for abduction of the arm at the glenohumeral joint, we have two muscles, which is the middle deltoid and the supraspinatus. The origin of the middle deltoid is at the acromion process and spine of the scapula. Insertion is at the deltoid tuberosity of the humerus. Actions include abduction of the arm, and innervation is the axillary nerve. For the supraspinatus, the origin would be the supraspinatus fossa of the scapula. Insertion is the superior aspect of greater tubercle of the humerus. Actions include abduction of the arm, And innervation is the subscapular nerve. As for adduction of the glenohumeral joint, we have 4 muscles, which is the pectoralis major, teres major, latissimus dorsi, and the coracobrachialis. So for the origin of the pectoralis major, we have the medial half of the clavicle. The insertion, again, is the lateral lip of the intertubercular groove of